For more on the act and its impact on healthcare, Anthony Chan joins us, former chief economist, J.P. Morgan Chase. Good to see you, my friend. Let me start with the Inflation Reduction Act. I know we're going to get to the healthcare part in a bit, but give me your headline thoughts on what you think of this act.
Well, it's based on the notion that if you essentially have a package that you pass out there and it doesn't really add to the deficit, but actually it reduces it, that to some extent that reduces aggregate demand and eventually it will dampen inflation. The problem is that what you see here is that this is a long-term package. And so the Inflation Reduction Act, yes, it plays a role, but it's not the major goal of this bill. It clearly has other goals, but obviously the Inflation Reduction Act title was a big selling point.
The White House is championing this as a major victory, reducing some household costs by the hundreds, if not thousands of dollars when it comes to health care, specifically drugs. Americans pay in multiples what other countries pay for the exact same type of drug. How will this bill ultimately impact that or help Americans?
Well, there's no doubt that if all of a sudden the government enters negotiation and convinces companies to do it, and if they don't, in good faith, what happens is that there's a huge tax, 95% tax. So the drug companies will have to negotiate, and it will start very slowly. I mean, in the beginning, it's only 10 drugs, and then it goes up. And gradually, by 2030, we're going to have a couple dozen drugs. So it is going to have an impact. Now, Phil, the only problem I have, and it's not getting a lot of attention, is that if drug companies know that they're going to be forced after 9 or 13 years, there are different rules for when that cram down or that negotiation goes into effect, guess what they'll do, Phil? When they introduce the drugs, the price of those drugs will be much, much higher, so that the incremental increases do not get into that problem where they exceed the inflation rate, but that's primarily because they charged up front. So if the price increases are front end loaded, you kind of get around this. But there's no doubt that this is going to work, but it's not as effective as the headline would suggest.
I'm very skeptical too, and I think you are as well. We have heard in every election cycle that whoever the candidate is going to negotiate lower health care costs when it comes to drug. And Canada is always cited as an example. Why do the Canadians pay significantly less for the same drugs that you and I might have to buy at a prescription pharmacy? Why can't we do what Canada does? I can't believe I'm saying this, but why can't we do what Canada does?
Well, got to remember that somebody has to pay for that R&D, and a lot of countries around the world get the benefit of these drugs. They get them at a discount, and essentially the U.S. is paying for the R&D. So somebody has to pay. But I think with this program, it's going to make some progress, but certainly not as much as the headline would suggest, because these drug companies will find a way to get around it.
Okay, who's paying for all this? So if now this isn't all about drugs, also there's the changes of healthcare charges or monthly fees. Somebody has to offset these changes, and I know companies have already been asked to pay a little bit more, but I'm going back 10 years ago on this. What's next?
Well, I think that's the companies will pay a little bit, because already in the equity market, they're starting to reduce the expectations for earnings in these companies. But if you ask me who's going to pay at least some of the bill, it's the private insurance companies. Remember, this bill is going to have the government, Medicare, negotiating the drug prices. But if you have private insurance, there's no negotiation. So they'll be able to have different prices in that area. So that's one area that will pay for this subsidy.
Anthony, why can't the White House get these drug companies, whether it's Pfizer or Glaxo, into a room and say, look, you guys need to figure out a way to reduce the cost of health care for Americans, specifically drugs. You come up with a plan. Why can't these private companies come up with a reasonable plan that can be enacted immediately?
Well, they have come up with plans, giving rebates, trying to allow people that have moderate means to get subsidies. But remember that if you are selling something and you come up with a plan, it's not going to be a plan that's going to totally damage your earnings stream, because after all, they have shareholders and they have investment rates of return hurdles that they have to they have to beat. So it's going to be a little bit of a challenge. The bottom line is that I think pharma will be hit, but it won't be hit as much as the headline suggests. And that's something that we have to live with in a world where we have very powerful lobbyists. This is the outcome that you get.
As a true capitalist, and I think you are too, why are we giving arguably discounts to the rest of the world? I mean, wouldn't the natural thing be is to charge the rest of the world more money and charge the U.S. a little less money to make it a bit more even?
Well, remember that in the real world, you charge based on what you think other countries would be willing to pay. And they have estimated that countries around the world are not willing to pay as much as the U.S. And in fact, in some cases, it's a good thing. Because if you sell the drugs to developing countries where they have moderate means and you give it to them at a very low price and therefore they're able to take care of themselves, even as a capitalist, I don't think that's such a bad thing. But again, if the country is willing to pay a higher price and you're trying to maximize profits, guess what you're going to do, Phil? You're going to go for the higher price.